Hello, I'm Anand Naidu, and welcome to this special edition of The Heat. I'm joining you via Zoom from my home just outside Washington, D.C. With COVID-19 changing the way we broadcast, this is the new reality that we face. The coronavirus pandemic continues to ravage the United States, and now a new government document projects the daily death toll could reach 3,000. This grim forecast comes as governors around the country continue to face political and economic pressure to get the country back on track. There's much to talk about. Let's bring in our panel. Joining us from Maryland, Dr. Ron Elfenbein is Medical Director and CEO of Chesapeake Urgent Care. With us here in Washington, Kimberly Leonard is Senior Healthcare Reporter for Business Insider. And also joining us from Washington, Brian Becker is Executive Director of the ANSWER Coalition. Thanks to all of you for being with us. Dr. Elfenbein, let me start with you. There's a government report out which estimates that coronavirus cases will go up to 200,000 a day, and the number of deaths will reach 3,000 a day by June the 1st. Those are alarming figures. What do you make of it?
Well, they are absolutely alarming. You got to remember, though, these are computer models. And as we've seen with multiple computer models, they don't always hit the mark. So you got to take it into context and take it with a grain of salt about what you're actually dealing with. So yes, the death rate as of June 1st should go from, according to the model, from 2,000 a day to 3,000 a day. And the question is, why is that? Well, the predictions are that it's going to go up like that because of the fact that we're reopening the country gradually, but it is happening in most states. And it's going to lead to a higher death rate. Whether it's 2,000, 3,000, 1,000, we don't really know. And please remember that this is all computer modeling. So the computer model is only as good as the person who programs it.
Does this tell us, Ron, that the efforts to flatten the curve are not working?
No. I don't think you can say that. Absolutely, the curve has been quote unquote flattened, and we've definitely made some strides in keeping sort of the medical system intact. The whole point of flattening the curve, bringing the death rate down, is that you prolong it, you make it over a longer period of time, but you don't overwhelm the medical system. And by far, we're nowhere near overwhelming the medical system. In fact, volumes in emergency rooms across the nation are down by 40 to 50%. But the people that we are seeing are overwhelmingly much sicker, and the acuity is much higher. Now, I don't just own an urgent care. I'm also an emergency room doctor, and I work in multiple ERs in Maryland and in Delaware. So I see this every day when I go to work. It is the reality. We are seeing lower volumes, but much higher acuity.
Kimberly, more than half the states in the United States are now reopening businesses and other facilities. Many have not met the criteria which have been set out in those White House guidelines that were issued a couple of weeks ago. Is the country risking another wave of infections, possibly more devastating than the first one?
Well, it certainly could, and we may see some states sort of reverse some of those openings if they really see some of those surges. As was mentioned before, we don't want to inundate emergency departments and prevent hospitals from being able to do the work that they want to do. And so there is some concern, especially after a lot of photos surfaced this weekend showing people not really social distancing very much. But we do know that people are anxious to get back to work, that there is fear about what would happen to the economy long term. But the problem with, not really having that balance is that facilities might be forced to close because there's such a surge in cases. So we'll be watching those numbers for sure.
And Kimberly, how much of a balancing act is this for the country's governors? On the one hand, they do not want to see more infections and consequently more deaths as well. And at the same time, they want to reopen their economies. They're under pressure from citizens around the country to reopen.
They are, and the effects that the shutdowns have had are not just economic, they've also impacted other parts of the healthcare industry. If you look at hospitals, their volumes are way down, which means their revenues are way down. A lot of people have foregone care. We know that some patients aren't going to the hospital when they think they've had a heart attack. We know that mental health calls are up, and we know that appointments are being pushed back. And so there is some concern that there's going to be a huge surge once the shutdowns are over of other healthcare cases that had to be put on hold during the shutdown and lockdown orders.
Brian, this crisis has become very politicized. The pandemic has spawned a whole host of conspiracy theories. And I guess to some extent that's inevitable when we have a crisis of this kind. But we are seeing some of these conspiracy theories come from the highest levels of the United States government, we had the United States Secretary of State, Mike Pompeo, saying that he had enormous evidence, in his words, that this virus came from a laboratory in Wuhan in China. We've not seen any of that evidence. Why is the government going after China?
Well, this is reckless and irresponsible on the part of the Secretary of State. It's also reckless on the part of the president, who uses his daily press briefings, whether they're announced as daily or not, they happen every day, to demonize and attack China and to spread these kind of conspiracy theories. In a way, it's the blame game. I mean, the American government has, in many ways, failed in the first few months to do what could have been done to flatten the curve earlier. There was also the lack of PPE, various parts of medical equipment, personal protective equipment. You have doctors, and healthcare professionals in trash bags rather than proper attire. There's been a lot of failure, and the blame game is a very sort of used trick. Don't blame me, blame him. And now, of course, stoking this anti-China conspiracy theory, which has been said by the World Health Organization to have no evidence, zero evidence. They've asked for the US government and the Secretary of State to provide such evidence, and no evidence has been forthcoming. Anthony Fauci from the National Institutes of Health here in the Washington, D.C. area, who's in charge of the Infectious Disease Institute, said yesterday there's no evidence whatsoever. So how could and why should US government officials who are not doctors, who are not scientists, be attributing a Wuhan lab, biolab, as the source, as the origin, with overwhelming evidence at a time when the scientists and healthcare professionals and healthcare officials internationally say no such evidence exists? That's the blame game.
Dr. Elfenbein, we are seeing protests around the country, people urging governors in states to reopen. Dr. Deborah Birx of the White House Coronavirus Task Force, she has warned that many of these protests are taking place with people not maintaining social distance. They're not wearing masks of any kind. They are causing even more risk because, as she points out, she could be taking the virus, the protesters could be taking the virus back to older people in their homes. We also saw packed beaches in California over the weekend. How big are these risks?
Well, they're big and they're real. And to kind of dovetail to what was discussed earlier, if you look back at prior pandemics, specifically the 1917, 1918 pandemic, you see the way different cities kind of dealt with lockdowns and social distancing. They didn't call it social distancing at the time, but it's the same thing. I mean, we learned from the past. And if you look at what, like St. Louis, for example, was really, really good at getting on this early, but then they opened up. And if you actually look at the curve that they had, it was an initial spike, and then it went down because they instituted all those measures very early. And then they opened up, and the spike went even higher than the first time. And their death rate was much, much higher the second time. So that is definitely a worry. And the fact that people with comorbidities, diabetes, high blood pressure, heart disease, all these things, elderly, they're at much higher risk. And you're absolutely right, because these protesters can go out, be exposed to God knows who, bring the virus back. Even if they don't get sick, they can still spread it. And they're going to give it to the older folks who are the most vulnerable and least able to handle getting sick right now. So we really got to learn from history. And one point I would like to stress is that opening the state of Wyoming, for example, is not the same as opening New York City or opening New York State for that matter. So it really has to be looked at on a state by state basis, and even maybe a municipality by municipality basis, because everybody's different. Every state is different. Everybody's dealing with different things. And we have the people best able to determine that are those on the ground in those individual areas.
Kimberly, some of these protests are ideological, some of them part of the cultural war that's taking place in the United States. But we're also hearing from a lot of people that it's driven by financial insecurity, by economic insecurity. They want to go back to work to earn money to be able to pay their bills, pay their mortgage, pay their rent, etc. What are you hearing from people in your reporting?
We're hearing a lot of concern. People aren't just losing their jobs, but because of how the U.S. Operates its health insurance system in this country, they're also losing health insurance. So some of them can turn to the marketplaces under the Affordable Care Act, also known as Obamacare. Others can turn to Medicaid. We know that lawmakers are meeting over the next few weeks to see what other kinds of relief packages they might be able to offer, whether that means additional stimulus checks to individuals, whether it means providing another another way for people to get health insurance at a lower rate. But we hear from people all the time who are concerned about going back to work. They don't know when the shutdown's going to end. They don't know if there's going to be another surge in the fall and that they're going to face this again. So there's a lot of concern as people are shut into their homes. You know, people often say that we're all in the same boat, but that's not true at all. Some people are able to work from home. Some people are laid off. And so it just really varies according to these different scenarios, and obviously the companies that they work for and whether they're filing for bankruptcy and the type of setups they have, whether it's furlough, which allows people to stay on their health insurance, or, you know, whether they're laid off without any answers as to when they'll be able to start again.
That's right. We've seen those jobless claims go up to 30 million. Brian, there's been some reporting that President Trump right now does not consider the pandemic his number one priority. His priority right now is the economy and getting re-elected. I mean, we can't forget that, of course, we are 6 months away from a presidential election. What do you make of that?
I think that's true. I think it's not the economy even. That's a subsidiary issue for the president. His number one concern is being reelected. And to that end, he's willing to risk a lot of people's health and safety. You know, there's another way the US government and the Trump administration could have gone. In Denmark, people did not lose their jobs. They got 75, 80%, even as much as 100% of their salaries. Same in France, same in other parts of Europe. This version of a kind of American hyper-capitalism straitjacketed the administration so that when they were finally compelled after minimizing for months, minimizing the danger, when they were finally compelled to shut down the economy to flatten the curve, then the responsibility came always to the individual. So you have 30 million, maybe it's really 40 million when you include those who are not eligible to file for unemployment insurance. 40 million people lost their job because the government said you can't go to work. And then those individuals, as your other guest said, they lost not only their job, but their health care. 12.7 million Americans in the last month lost health care from their employer-based plan with their families. That means about 30 million people lost health care. So of course, individuals having no option say, we must go back to work. And the president who wants to get reelected says, well, then let's bring them back to work. But the other way would be to make sure that people are fully compensated so that they're not in a crisis, so that they don't lose their health care, so that they're not in this chaotic state, and then make all other issues secondary to that, rather than the president's position, which is, I must be reelected. That's the number one priority for the country and the world. And certainly I'm going to do everything, even if it means after November, a lot more people are going to be sick and a lot more people are going to die.
Yeah, and Brian, the government has just announced that it will be seeking another $3 trillion. It wants to borrow $3 trillion. Where will that money be used?
Well, if the first go round is any indication, most of it went to corporations, it went to banks, it went to hedge funds, it went to the largest corporations. Even the Small Business Administration loans that were designed to keep small businesses afloat during this period of crisis, much of that was sort of harnessed by big corporations or those who had business accounts with the biggest banks. A lot of people missed out on this. I know small business people who filed at 8 a.m. on the first day for the Small Business Administration loan. They got nothing. And we have 30 million small businesses in America. A large number of them are either bankrupt or on the verge of bankruptcy. I don't see how the $2 trillion, unless it's administered far differently, will actually save them at this point.
Dr. Elfenbein, testing shortages continue to bedevil the American effort to counter this pandemic. In one instance, we had in Maryland, actually, the governor had to go out and buy 500,000 kits from South Korea. In many instances, states are on their own. Is the country still playing catch up when it comes to testing, or is there still a shortage?
So it's a good question. I own, like I said before, I own an urgent care, and we've been testing. We've been testing both antibodies and PCR tests, and we've had no problem getting tests. We found through the open market that we could find places that had tests and would run the tests, private laboratories. You mentioned that our governor in Maryland, Governor Hogan, went out and spent $9 million on tests. He didn't actually spend it on tests. He spent it on part of the kit, which doesn't come complete. So he spent $9 million on something that we're not even gonna be able to use really. And there's no infrastructure to use them. So there's no lab to run the test. There's no one that can administer the tests. So I think there's a lot of sort of ramshot, approach to this, and everybody's just trying to scramble to get tests. But I really believe that I was able to find tests. How was I able to find tests for my small urgent care? I just got on the phone. I started calling different labs, and we found one that could service us. And I think the government really should look to private sector, create jobs, help the economy to do this. It doesn't have to be all government. The government can help by finding small businesses that want to help, that have the capacity to do it. They're out there. I know it because I have one that's servicing us. So I think there is definitely a problem. We need to test more people, but this notion that there are not enough tests out there is nonsense, because again, I was able to find them for my urgent care. Now, obviously I'm not talking about testing 300 million people, but we're testing thousands of people, and we're testing nursing homes, and we're testing nursing home staff. We were able to do it. So why can't the state government? Why can't the federal government? Why can't the county government? They need to look to the private sector to do this.
What are you seeing and hearing, Kimberly, insofar as testing is concerned?
Well, we do still hear from patients who say they have trouble getting access to the tests. We know that the federal government extended coverage of these tests. So that means people aren't supposed to be paying out of pocket for them. The health insurance companies are supposed to pay for them. So that's supposed to help a lot with the cost. We have heard, though, from patients who not only get tested for the coronavirus, but end up also getting tested for the flu and have seen out of pocket costs from that. So there seems to be a little bit of a sort of an adjustment in terms of figuring out, how to bill those services so that people don't face out of pocket medical bills for the treatment and care related to the coronavirus.
Can I just jump on that for a second? I'm sorry.
Yeah, go ahead.
So she's absolutely right. And that is a problem. And that's per CDC recommendations, rule everything else out, other causes like the flu, strep, other things like that. So the state of Maryland was very good about that. And they instituted very early that anything related to coronavirus testing is covered by insurance 100%. No out-of-pocket costs for patients. And if they have no insurance, there's a state insurance fund that will pay for them. So you're absolutely right, Kimberly, that's absolutely true. People should not have to choose between eating a meal or having to get tested for coronavirus.
Kimberly, one other point, Brian just told us a moment ago that, millions of people have lost their jobs, but at the same time, they've also lost their health insurance. So what kind of recourse, these are millions of people that we're talking about, what kind of recourse do they have right now without health insurance?
Well, it's difficult depending on the state that you live in. So the Affordable Care Act, which is commonly known as Obamacare, allowed for states to expand their Medicaid program, which allows people who are low income to enroll into essentially a government coverage program that offers coverage at little or no cost to them. There's a little over a dozen states, though, that haven't expanded Medicaid. Other people have the option to sign up in what's known as the Affordable Care Act marketplaces, and a few states have allowed, uninsured people to be able to enroll in them. But if you've lost your job, you automatically are allowed to enroll. The problem is that in order to figure out what kind of subsidies you need to make the health insurance affordable, you have to be able to project what your income will be for the year. And that can obviously be difficult to do at a time like this when we don't know when everything will reopen. So there are various efforts in Congress right now to make sure that we kind of fill those gaps. One of them that we're kind of keeping an eye on over at Business Insider is a plan that would allow people to stay on COBRA by providing government subsidies to pay for them. So essentially the same coverage you're getting through work, you'd be able to stay on that, and the government would pay a large portion of your plan that used to be covered by your employer.
COBRA is a government-run service, right?
It allows people who lose their jobs to stay on the same health insurance that they were on before, but a lot of people don't realize how much their jobs contribute toward their health insurance. So when they see some of those premiums, they think, wow, that's a lot more than what I used to pay. And really, it's because your employer kicks in so much.
Brian, even before this pandemic, healthcare was a big issue in this presidential election. We heard that rallying cry of Medicare for all. Do you think it will still remain a major issue in the election?
It has to. I mean, this crisis has really revealed in the most glaring kind of way the fundamental problem with this patchwork for-profit healthcare system, which varies from state to state, from place to place. And the argument against Bernie Sanders and the Medicare for all was workers don't want to give up their great Cadillac healthcare plans if they were lucky enough to have such a plan with their employer. But that's always premised on the idea that you have a job and that your employer is still afloat. And right now, people have lost their jobs, and many companies have become bankrupt or are on the verge of bankruptcy. And so that entire argument why that the American healthcare system with the private market as the driver, or an employer-based program is the driver, it shows how inadequate it is. I mean, when you have 30 million people in a month lose healthcare at a moment when there's a healthcare crisis, it shows the ridiculousness of the system. So I don't see how this doesn't become a major factor in the healthcare, in the election. The healthcare debate is the debate in America. Americans spend more money on healthcare than all the other industrial capitalist countries in Europe spend, and they get less for it. Yes, there are many attributes to the American healthcare system, but the deficits are glaring.
Okay, and that's where we have to leave it. Thanks to all of you for being with us.
Thank you.
Thank you.
We are going to take a short break right now. We'll be back right after that. Stay with us. You're watching The Heat.
In a world that's constantly moving, what is it that really defines us? Is it the ideas of our time or the trends that shape our lives? Full Frame, weekly on CGTN America.
Welcome back. Japan is extending its state of emergency until the end of this month. The measure comes amid growing criticism over Prime Minister Shinzo Abe's handling of the coronavirus outbreak. Joining us now is Yuko Tsukamoto, who is a professor at the Department of Nursing and Social Science at the Health Sciences University of Hokkaido in Japan. Yuko, thanks so much for joining us.
Thank you for having me.
The Japanese Prime Minister Shinzo Abe, he has extended the emergency in the country. What prompted that extension?
Actually, for number of infected people didn't decrease as much as we wanted to, so he decided to extend the state of emergency.
So what is the situation in the country right now?
So right now, the total number is 15,000, around 50,000 and 521 deaths as of yesterday.
What does this lockdown mean in Japan? Are schools closed? Are businesses closed? Are people allowed to go out, or are they confined to their homes?
So right now, all the schools are closed, but most of the shopping centers are closed, but supermarkets or grocery stores are open. And also drug stores are open, and what else is closed? The daycare centers are all closed.
Are people generally complying with these restrictions in Japan?
Yes, very much so. I think that people is actually staying home as much as we can, but at the same time, in terms of the working, we don't have much system to do the telework. So that was the challenge for many companies, especially small businesses.
You know, the Prime Minister has been criticized for not acting quickly, for not acting fast enough. Is that criticism justified?
I think that still the criticize is still on because he asked many businesses to close, but at the same time, he doesn't do the enough compensation to close the business. So that was the problem right now.
So are businesses getting some kind of compensation? What about the people who are going to be unemployed because of the closing?
We're getting the compensation, the stimulus package for every citizen for, in US dollars, about $1,000 each person.
What about testing in Japan? I was looking at some figures. I mean, if you take a city like Tokyo, which has got a huge population, 9.3 million people, but only 11,000 tests have been carried out in this city. That's a very small number.
Yes, I agree. And Prime Minister Abe promised beginning of April, he's going to increase the testing capacity to 20,000 a day but that's overall Japan, but it hasn't reached. Like, I think that it depends on the day, but average of testing carried out, it's about less than 10,000. It's about 9,000 or 8,000 a day.
What about protection for healthcare workers in hospitals? You know, we've seen this has been a problem throughout the world, but what about Japan? I saw a report actually where some hospitals were calling for people to send in raincoats, which they could use to protect themselves against the virus.
Yes, that's correct. We got limited number of PPE, so we have to be creative to reuse the masks or face shield or other gowns and stuff. And also we creating using the garbage bag to creating the gowns and face shield and other stuff. But we are reusing the masks as well.
Is the government doing anything about fixing those shortages?
Yeah, they said they've been trying, but again, the shortage of masks it's happening all over the world. So it's just hard to get, I guess it's hard to get the masks. Or, you know, the company called Sharp, making the electronic stuff, but they are now start making masks in Japan to help the shortage.
Right. You know, the island of Hokkaido, where you are right now, it's a classic test case of acting too quickly. There was a lockdown put in place very quickly, and it worked. You didn't have that many infections, but then that lockdown was lifted and you had a second wave of infections. What kind of lesson did that tell you?
We had, Hokkaido has their own state of emergency in place in end of February and lasted about 3 weeks till March 19th. And before the state of emergency was lifted, we got number of infected people. The previous days is like 1 or 0 or 1 or 2, very few. And then after state of emergency lifted, beginning of April, we start increasing the number of patients. And now, as of today, we almost have 700 patients now. In the beginning of April, we had about 200 patients. So that was a huge increase.
You know, Japan has a significant number of elderly people, 28% of the population, that's 1 in 4, are over the age of 65. And we know that this virus attacks older people. Older people are particularly vulnerable to the virus. How concerned are authorities over the elderly in Japan? What are they doing to protect them?
It's actually, especially in Hokkaido is almost 30%. It's actually more than 30% of elderly population, so very high compared to rest of Japan. So elderly people's government is actually warned the fact that elderly people is more vulnerable. So they decide, actually they take their precautions, so they try to stay at home. And also, I think before this coronavirus happened, Japanese people has a habit of wearing masks, protecting from the pollen allergy or even from the humidity. During the wintertime, it's very low humidity, so protect from the low humidity, it's people wearing masks to begin with, but they kept going to wear the mask whenever they go in public.
Yoko Tsukamoto, thanks so much for joining us.
Thank you.
And that's it for this edition of The Heat. I'm Anand Naidu. Thanks for being with us.
CGTN, covering coronavirus. From Asia, Africa, Europe, and America. The dangers, the uncertainty, a global effort to stop the spread and save lives. For the latest updates on coronavirus, stay with CGTN. See the difference.